Okay, so picture this. It's my cousin's wedding. I'm about to catch the bouquet. And bam, a rogue olive pip takes out a chunk of my front tooth. Talk about a wedding to remember right. Thankfully, it wasn't as dramatic as it sounds, but it definitely got me thinking. What to do? I have a real dental emergency ever strikes.
Oh, wow.
And that's what we're diving into today. You've shared some concerns about broken teeth, so we're going beyond the basic Google search here. We've got a stack of research, and with the help of our expert, we're going to unpack it all, turning you into the most prepared person in the room when it comes to dental dilemmas.
I like it.
Now, before we get into all the nitty-gritty, I have to ask, have you ever heard the term craze lines? I hadn't, but apparently there are these tiny hairline cracks in your teeth. Totally normal.
It's true. Think of them like the fine lines you might see on a well-loved vintage ceramic plate. Most adults have them, and they're rarely a cause for concern.
That's a relief. But our sources say that not all cracks are created equal.
Right.
There are craze lines, and then there are the, oh no, I need to see a dentist right now kind of cracks.
Absolutely. A broken tooth, or tooth fracture, can range from those barely there craze lines to more serious breaks, the ones that expose the inner layers of your tooth, like the dentin and pulp.
And those inner layers are where things can get a little dicey if bacteria creep in.
Yeah.
So walk us through those red flag scenarios, the ones where it's a definite dental emergency.
Our sources outline three main scenarios. First, if you're hit with intense pain or bleeding, that's your cue to call the dentist immediately. Second, if the break goes beyond the enamel and you can see those inner layers we talked about. Imagine biting into an ice cream sandwich and hitting that unexpected hard candy shell, not the best surprise. That's a sign you need to see a dentist ASAP.
Okay, that visual really paints a picture. And the third scenario?
The third is if the tooth is completely knocked out. We're talking sprinting to the dentist kind of immediate. This is the most severe type of break. Requires immediate attention to try and save the tooth.
Noted. But let's say it's not quite that dire. Maybe you chipped a tooth, and it's a little sensitive, but not throbbing. What then?
In those cases, it's perfectly fine to wait a day or so before seeing a dentist, as long as you're practicing good oral hygiene. But this is where it gets interesting. Our research showed that people over 40 are actually more prone to broken teeth.
Really? Now that you mention it, I've heard that before. But why is that? Are our teeth just more brittle as we age? Like old breadsticks?
There are actually a few reasons. Years of chewing and clenching can weaken the enamel, making it more susceptible to cracks. Plus, many adults have had fillings over the years, and those fillings can weaken the tooth structure.
That makes sense. It's like how a piece of tape, while helpful, can sometimes make a paper more likely to tear along that crease over time. So age, wear and tear, even past dental work can all play a role. Okay, that's a good reminder to be extra cautious as we mature. But back to those less urgent situations, are there any home remedies we can use in the meantime while we wait for our dentist appointment?
Absolutely. Our sources recommend a few simple things you can do for temporary relief. Rinsing your mouth with warm salt water can help clean the area and reduce inflammation.
Salt water, the classic home remedy. What else?
Applying a cold compress to the outside of your cheek can help reduce swelling. And this is important. While you might reach for an aspirin, our sources specifically caution against it.
Really? Why is that?
Yeah.
I would have thought aspirin would be helpful for the pain.
Aspirin thins your blood, which can actually increase bleeding, especially in dental situations.
Wow, I had no idea. So acetaminophen is a safer bet in this case.
Exactly. It'll help with the pain without the added bleeding risk. You can also try using dental wax to cover any sharp edges on the broken tooth, preventing further irritation to your tongue or cheek.
That's good to know. Dental wax, who knew it, had so many uses. It's like the duct tape of the dental world. But speaking of dental fixes, let's talk about the different repair options. Our research outlines 7 treatments, and what I found helpful is that they can be grouped by the severity of the break.
You're right. For minor chips or cracks, something like bonding or reshaping might do the trick. Bonding is like getting a tooth-colored filling sculpted onto your tooth to restore its shape. Imagine a sculptor meticulously molding clay. It's kind of like that, but on a much smaller scale.
So if I chipped my front tooth on that olive pit, bonding would be like a little cosmetic touch-up.
Precisely. Now, reshaping is even less invasive. It involves gently removing a tiny bit of enamel to smooth out any rough edges.
Kind of like sanding down a snag in wood.
Exactly. Now, if the damage is more significant, let's say you've lost a larger portion of your tooth, your dentist might recommend a crown or a veneer.
I've heard of those. They're like little tooth coverings. Right.
Yes, a crown covers the entire tooth, providing all-around protection and restoring its shape and strength. Think of it like a little helmet for your tooth. A veneer, on the other hand, is a thin layer that goes over the front surface, primarily for cosmetic purposes.
So a crown is like replacing the whole roof,
Yeah,
and a veneer is like adding some nice siding.
I like that analogy. Now for the most severe cases, where the tooth is beyond repair or has to be extracted. Dental implants are an option.
Implants are those titanium roots that they surgically implant into your jawbone.
Right. They act as artificial roots for replacement teeth and are known for being incredibly sturdy and long-lasting.
That's right. And finally, there are inlays and onlays, which fall somewhere between fillings and crowns in terms of coverage. Inlays are used to fill cavities or cracks within the cusps of your teeth, those pointy parts on the biting surface.
Okay, so inlays are for those inner cracks. And what about onlays?
Onlays are like partial crowns, covering a cusp or multiple cusps. They provide more extensive coverage than inlays, but aren't as comprehensive as a full crown. Got it. So basically, a step up from inlays in terms of coverage. It's amazing how many options are available these days, from simple fixes to more involved procedures. But I think it's safe to say that most people, myself included, are probably wondering about the cost of all of this.
You're definitely not alone. Dental care can be expensive. And that's why I appreciate that our sources provided some concrete numbers.
Okay? So according to what we've gathered, the cost to fix a broken tooth can range from around $300 to $2,000 without insurance. That's quite a spread.
It is, and it reflects the variety of treatments available and the complexity of each case. For instance, a simple bonding procedure will likely cost less than a root canal and a crown.
That makes sense. More involved procedures, higher price tag.
Exactly. And remember that $300 to $2,000 figure, that's without insurance.
Which, let's be real, is a significant chunk of change for most people.
Absolutely. To put it into perspective, that's like a new phone, a fancy espresso machine, or even a weekend getaway.
Okay, you're making me crave both a latte and a vacation now. But seriously, knowing this cost range beforehand highlights why it's so important to understand what your dental insurance covers.
Couldn't agree more. It's like deciphering a secret code sometimes. But taking the time to understand your plan's coverage for different procedures can save you a lot of stress and money in the long run.
So call your insurance provider. Ask those questions. And don't be afraid to get into the nitty-gritty details of your coverage. Knowledge is power.
Right. But beyond the immediate costs and logistics, I'm curious about the bigger picture. What are the long-term risks of ignoring a broken tooth?
That's where things get really interesting. We often focus on the immediate pain and discomfort, but the long-term implications can be significant. So enlighten us. What are we talking about here?
Well, for starters, even a small crack in your tooth can create a pathway for bacteria to enter the inner layers, potentially leading to an infection.
And we know how much havoc an infection can wreak, not just in our mouths, but throughout our bodies. It's amazing how interconnected everything is.
It is. What starts as a seemingly minor annoyance can escalate into a much bigger problem, requiring more extensive and costly treatment down the road.
So it's not just about aesthetics or a little pain. It's about protecting our overall health. I'm getting the message.
Exactly. And there's more. Ignoring a broken tooth can also lead to problems with chewing, and even affect your bite alignment.
Because if you're favoring one side of your mouth because of a broken tooth, it's going to throw everything off balance.
Precisely. Over time, this can lead to jaw pain, headaches, even problems with your temporomandibular joint, that hinge that connects your jaw to your skull.
The TMJ, I've heard of that. It's no joke when that gets out of whack.
Not at all. So even if you think a broken tooth is minor, seeing a dentist is crucial for preventing these potential long-term complications.
Okay, point taken. Dentist appointment it is. But before we wrap up, let's talk prevention. We've covered a lot of ground on what to do if a tooth breaks, but what about dodging that dental drama altogether?
Love it. Prevention is key. And thankfully, our sources had some great insights here.
Yes, with the wisdom.
It all boils down to this. Good oral hygiene is the foundation of a healthy smile. Brushing twice a day, flossing daily, using a fluoride mouthwash, these habits are like building a fortress around your teeth.
Okay, no big surprises there. But sometimes we need that reminder. It's like eating our vegetables. We know it's good for us.
Exactly. And speaking of food, diet plays a big role too. Limiting sugary drinks and snacks can go a long way in protecting your teeth from decay.
Makes sense. Sugar is basically fuel for those nasty bacteria that love to munch on our enamel.
Right. And if you're a fan of chewy candies, hard candies, or crunching on ice, you might want to rethink those snack choices.
Message received. Farewell to my jawbreaker days. Anything else we should be mindful of?
Absolutely. If you play sports, especially contact sports, wearing a mouthguard is non-negotiable.
That's a no-brainer.
Hmm.
You'd be surprised how many people, Even recreational athletes skip that simple precaution.
It's one of those things that seems minor until
Yeah.
it's not. A small piece of plastic can literally save your teeth.
Truer words have never been spoken. Well, we've covered a lot of ground today. Everything from understanding different types of breaks to treatment options, costs, even how to avoid needing those treatments in the first place. It's been quite the deep dive.
It has, and I think it's safe to say our listener is now the most informed person in their room when it comes to broken teeth.
That's the goal. But before we sign off, I want to leave everyone with something to ponder. We've talked about all these great preventative measures, but what's one small change you think our listener could make in their daily routine to really step up their oral hygiene game?
Ooh, I love that. It's those small, consistent habits that make all the difference. Maybe they could try an electric toothbrush, or set a reminder to floss before bed, or even just be more mindful of what they're snacking on throughout the day.
Such great ideas. Sometimes it's the tiny tweaks that have the biggest impact in the long run. Well, on that note, it's time for us to say goodbye. But remember, knowledge is power, especially when it comes to your health. So stay informed, stay proactive, and keep those smiles shining bright.